people in Islington who are really struggling with mental health problems, and it's really important for them to be able to have somewhere that they can go to in Islington that's easy to get to.
You need to have accessible community services. You need to have reasonably good open door policies where people can come in should they need to come in if they have difficulties.
I think the services here are vital, really, helping people with all manner of problems and difficulties in their life.
I've been coming to Lowther Road for 15 years.
I manage a small team of nurses who undertake annual health checks on people who have serious mental health problems. And we do that in GP practices, but we'll do it sometimes here at this team base, and we'll do it in people's homes. So being able to sit here in Lowther Road is absolutely essential, in that I need to be able to have access to care notes. I need to be able to see my colleagues, to be able to raise and flag any concerns.
It's very easy for most service users to get to. It's also been quite nice for staff because we do a lot of home visits.
We are in between two main train stations. We have a really good bus service here. A lot of clients are local.
Really encourages people to use us rather than, say, go to the hospital if it is that they felt they were in crisis.
It's also very, very close to the partners that we work with, which is really crucial, really.
It's really easy for me to walk here in 15 minutes.
Very often I leave here and I walk down and take a nice stroll and do my shopping before going home.
I think having mental health services sort of stuck away in little buildings on their own does increase stigma, because it sort of gives a message to service users that they have to go to a separate place from other people.
Some people do struggle with the stigma of mental illness and engaging with services because of that, and I think taking that into account and trying to make it as welcoming as possible will help.
An improved sort of staff area would improve cohesion and relationships within teams, which I think would have a really positive impact on how we're looking after our service users.
Sometimes they come in, they may be a bit tense or upset, and we have to kind of put them into an office.
There's an awful lot of floor space that probably is underutilised. I think there's also an issue around the temperature management. In the summertime it's boiling hot in here, in the wintertime it can be really very cold. A big issue around sound travelling in terms of privacy. It's not great on that respect.
But at the moment the rooms are all quite awkward in their shape. They don't feel that comfortable, they're quite sterile, they're not really very inviting.
I think the redevelopment would be a really positive thing. I think it's really vital that we can access more services under one roof.
The one-stop to have services such as benefits advice and debt management, that can only be seen as a positive thing.
I think the things that we would like to see is some spaces where we can do group work.
The users of the services that we provide here often come in for an array of appointments. Sometimes they may have more than one appointment in one sitting. If we had something, for example, like a kiosk, where people could get a cup of coffee or some drinks or other types of beverages, they could also socialise with one another. So it would be a social aspect as well as just coming in for their general appointments.
Patients can sometimes be transferred between different teams, and then I think it is helpful sometimes to have a good working relationship between those teams so that transfers can happen smoothly, and that obviously is helped by people working closely together, being co-located.
In terms of the awareness of the programmes that we're delivering, I think it's much more transparent when you're actually in the same building and talking to people, so they get to know who you are, what you're doing.
We have an opportunity to develop and design services that would be fit for mental health service users in the 21st century.
I think it's very therapeutic if they do have somewhere like Lowther Road to come to come see their peers.
The centre has, and the services provided for me is life-saving, really. I wouldn't have been able to cope without it.